And we are live.
Well, good evening, everyone. I'm Kathy Turner, and I'd like to welcome you to Healthy Start in a parent overview this evening. And tonight we're featuring a new doctor who I'm so excited to share his story, and he is going to share our story with you. Healthy Start is a program that's primarily targeted at children who have things that maybe their parents are a little concerned about. And if you're starting to see some of the things in your own children that make you wonder if something's not quite right, or how you would know, or what you would identify, where to begin and what to look for, this is probably going to be a very, very informative hour for you. And I would encourage you to go ahead and pour yourself a cup of coffee or a cup of tea and take note on what you're learning, and don't hesitate to ask a question. There's a little Q&A area for you. You can get those questions across, and if they're not answered along the way, by the time we get to the end, you're going to hear directly from Dr. Cope on some of the things that specifically have you concerned. So this is Dr. Shane Cope, DDS, but I want to share the story of another doctor first, and he was the first. He's the innovator. He's the one who really put all of this into motion. He is a world changer, and I mean it quite literally. Board certified orthodontist. This is Dr. Earl O. Bergerson. DDS, MSD, ABO are his credentials. And he started a program and a company called Ortho-Tain 50 years ago, back in 1967. He is the inventor of what you're going to learn about tonight, and that is a system of treatment. It's the HealthyStart treatment system. He taught for 25 years as a professor at a dental school, Northwestern Dental School in Chicago. It's not any longer there, but there was a hall named after him for what he has done. And in fact, in the last year or so, he has been honored with a humanitarian award for the contribution he has made globally to children's health. This is a man who has a genius, inventive mind, and also a life's legacy developed over caring for these children. Now in 43 countries with full operation, maybe 100 countries as far as some level of involvement with this treatment. He's treated over 3.5 million children around the world, and he holds 514 US and international patents. He's delivered well over 500 seminars. I don't know when they stopped counting. He's been published over 80 times and holds 80 monographs. This is something that is cleared by the FDA, Health Canada certified, makes it equivalent of about a class 2 medical device. There are no BPAs, no silicone, no latex. The appliances and even the cases that they come in, which are absolutely adorable, are antimicrobial. It's ISO certified, and of course we always love to tell you that yes, it is an American-made product. Now I want to share with you who you're going to hear from tonight. This is Dr. Shane Cope, DDS, from Lafayette, Indiana, and the name of his practice, and actually has two next door, one more focused on medical and one more on the dental, but the Highland Creek Family Dental operation is the one that people there are very familiar with. A lot of the parents that are tuned in tonight are from that general community between Indianapolis and Chicago, and the rest of you all over the country. And you're always going to learn, we always do when we hear, and especially when you have a grasp of the insights and the perspectives that these doctors bring to the conversation. So I'll tell you a little bit about Dr. Cope. During dental school, he developed a love of surgery, which led him to complete a 3-year periodontal residency. He is a graduate of 2006 of Indiana University School of Dentistry and Crawfordsville. That's where he went to high school, and then on to the University of Indianapolis, where he majored in biology. Two of Dr. Cope's main focuses in dentistry are very important to you because it's about making you feel comfortable and listening to your questions. You're going to hear a lot of that tone in what he shares with you tonight. And then, of course, he will bring solutions that will lead to optimal oral health. Boy, is he in the right spot, and so are you. At home, he's very happily married to Carly. They have, since 2003, now 3 children. I think that that's somewhere around 8, 10, and 11. I might not have got that right, but right in that range. And of course, the experience of what they're doing at HealthyStart in their own house is also something that comes out in every conversation. By the way, most of us have had some really life-changing event for somebody that we love or our family members because of this, and that's the case here too as well. So they love to spend time together with their children involved in their church, and the greatest fun little factoid that I can share about Dr. Shane is that he trains and competes in triathlons. So on top of everything else, he's very diligent. He's all about health, and he's got a great energy and a competitive heart and spirit. So Dr. Cope, I'm so excited to have you with us, and that Indianapolis area community that you bring to the table with us this evening. Go ahead and take over the screen, and parents everywhere across the U.S., sit back, relax, and take a lesson from Dr. Cope.
Sure. Thanks for that introduction, Kathy. So one of the things that wasn't quite mentioned there was sorry, I'm trying to get my screen to come up here. There we go. One of the things that brought me to this is I have, like Kathy said, I have 3 children, and a lot of them shared and a lot of these symptoms that you see on the screen right now, and that kind of pushed me to pursue a specialty degree in oral medicine and oral facial pain, which I'll be finishing up here in the next few months, actually. So I really do have a love for this, especially to help out children. So as you can see on the screen, that this really is a silent crisis among children in America and all over the world. And we'll talk about why here in a little bit, but I'm not going to read through all of these, but as you can see, an estimated 9 out of 10 kids suffer from one or more of these symptoms. And so what's the common denominator or thread through all of these? And that's what we're here to kind of talk about and learn more about. But as you read through these, a lot of these are things that people wouldn't associate together as dentists or even the medical profession. But as we'll kind of go through this more and more here, we'll learn that how they're all related. So as we talked about, research over the last 20 years has really shown that all of these symptoms have been linked in one way or another to sleep disordered breathing. So what is that? That's just a general term for a series of chronic breathing disorders that affect not only adults, but also children. And as we learn more about this, we learn more about how severe it really becomes. So right now, what are some options that are available to help parents with their symptoms that they see? Well, unfortunately, here in America, a lot of the problems that we seem to have are treated with drugs. And I see far too many children, especially, that are running around at very young ages on multiple medications. And you kind of just go through this list of surgery, sleep aids, special education or tutoring. I mentioned my children. I had my daughter went through a couple years of speech therapy because of some of these things that are related to just the formation of the dental arches and things like that, which we'll talk about. So again, I have 3 kids. All of them are currently in the treatment, and it's really helped out dramatically with not just sleep, but on some of the other things that you saw listed there. So as you can see, there's not just really a great solution to a lot of these problems that we're having. What do they all share? Well, we're really just treating the symptoms and not the root cause. We like to use the term Band-Aid for these sorts of things. And again, unfortunately, in this country anyway, that's kind of how we treat a lot of medical issues, unfortunately. Instead of treating what's really the underlying factor, we just want to get rid of the symptoms. And in a case like this, it can really have a lot of detrimental problems to children. Often, again, as I talked about, they involve several drugs, and it's silly to assume that children who are on 3 or 4 different medications that change their brain chemistry, that there's no side effects to this. So as we go through this, there are ways to treat some of these things without drugs and other ways. And again, they can be costly, painful, time consuming, not just for the child, but for the parent. Again, especially when you talk about ADD, ADHD, most of the medications that the children are on for those, they require monthly doctor's visits, and people are having to take off work and everything else to go to these monthly visits, miss school and everything else. And a lot of times they're still ineffective. Children are children, and there's certainly a place for medication and some of those other things that you saw, such as surgery and CPAPs and other things. But again, a lot of these things could possibly be avoided. So that's what we're here to talk about. So again, I'm a dentist, even though I have a lot of focus on a lot of medical issues. So how can dentistry help solve a lot of this that the healthcare system or the medical healthcare system so far just doesn't have a great solution to? So that's what we're here to talk about. As dentists, we do have the knowledge and tools that can not just impact children's oral health, but Also the airway, oxygen and everything else that's so important and vital to children's growth and development. Now that again, as we're learning more and more about this, it's not just about cavities and straight teeth. Those are all, very, very important things. But this is here we're talking about the overall future health, well-being of every child, which every child deserves that. They deserve, what we say, they deserve the healthy start, which they do. So that's what we're here to talk about. One thing I've learned to look at over the many years of my education is I look at children differently than I used to. When I look at, the two children you see on the screen here, they appear to be fairly healthy, maybe a little tired of what, even myself maybe would have said several years ago. But when I look at this now, I understand that children shouldn't look this way. They shouldn't have the dark circles under their eyes and things like that. They're just saying sleeping like a baby for a reason. Children should sleep well. They shouldn't have a lot of the stress and problems of sleep that we as adults may have. And that's what we're here to kind of find out about is, again, am I a healthy child? When we look at that initially, you might think, yeah, they just look a little tired. But as we learn more and more about this, well, maybe they're not so healthy. And again, we're not here to say that any child is not a great child. Like what we like to say is we're here to make your great child even better. And so we look at things a little differently than we used to. And again, some more pictures of maybe before what even dentists or orthodontists even, this is a traditional orthodontic picture that they take in their offices for braces, and they may have looked at this, not even considered airway involvement. But when I look at this, I see the jaw, the bottom jaw, how it's pushed back. It's what we call a retrusive bottom jaw. And that compromises or shrinks down that airway, causing a lot of problems. So I just look at these things differently, and so do a lot of other practitioners now. And that's what we're here to do, is try to not just help the straight teeth and cavities, but help the child develop and grow in proper ways. So what are some of the root causes of this epidemic that we're seeing with children and the sleep disordered breathing? Well, obviously a greater awareness. The more we know, the more cases we're going to find. That just makes sense. So they've probably been around for a long time. We just didn't know about it. But the more we know, the more better we are to go into treating these children. And again, as we find out more things, I'm not going to necessarily go through everything here. Some of these get kind of technical, but mouth breathing isn't normal for children. It's a learned behavior due to the tongue, where we place it. But what does that do? Well, over time, that pushes the mandible or bottom jaw and tongue back, which closes the airway off or reduces the airway. Habits as children are growing, like finger sucking, lip sucking, tongue, what we call tongue thrusting or reverse swallowing, are all learned behaviors that, again, disrupt a child's normal breathing pattern and decrease their ability to breathe through their nose, which is normal. All of these things that it says here, just causes a decrease in nasal breathing, not just with the breathing, but also sleep. As we go into the sleep functions, and as I always tell my adult patients that I treat for sleep problems, sleep is one of the most, complicated biologic processes our body goes through. So many things have to happen in order for an adult or child to get a good night of sleep, that if any of those things are disrupted, it can cause this kind of domino effect, which can cause problems, which, with bedwetting and other things like that you saw about. And we're learning more and more about that. And all of these things combined, what do? Well, these things can cause behavioral, social problems. If children aren't sleeping well, they're not going to behave properly. Anyone with children know that. You get a tired, cranky child, it's pretty easy to pick those kids out that, hey, that kid needs a nap, right? So here we're talking about it on a more chronic scale. But what do you expect? It's not a child's fault that they're not feeling well if they're not sleeping. So that's what we're here to talk about, to get the information out, if nothing else, just for parents to be armed with going into doctors and finding these things out. One of the common things that I hear all the time, and one of the pet peeves that I can't stand, even with my own children growing up, is when you hear physicians or even dentists or whatever it is say, oh, they'll grow out of it, whatever it is, fill in the blank. And I think usually we just use that as a fill in the blank for things that we don't necessarily know a lot about or know how to treat. Or they just generally, they truly believe that we're going to grow out of, children will grow out of these things. I had my oldest son who, had severe night terrors and sleepwalking and all these other things that if I would have known 7, 8, 9 years ago what I know now, just like my daughter with speech therapy, I think I could have avoided a lot of those problems just on treating the sleep problems, the sleep disorder breathing that he had. So here we look at, whether or not children really grow out of things. But when you look at this, a 2-year-old child's already 55% developed in their facial region. 4 years old, we're talking 75 to 80%. At 12 years old, they're all, 90 to 95% already fully developed. So I always push back and say, well, when do they grow out of it then? If a 4-year-old's already 75 to 80% grown, when's that going to happen? And unfortunately, it doesn't happen most of the time. But there are ways that we can correct these things, these malocclusions or facial growth as children grow. And that's what's the beauty of this system is. We're not trying to pull on things later after everything comes in and is fully grown. We're guiding the growth of not just the teeth, but also the whole face to allow it to grow in a proper position. So what is that proper position? Well, it's a down and forward position. That's the way the face should normally grow. And that helps open that airway up and causes so many other benefits of things that a lot of children don't get to experience because of the improper growth and development. And again, that comes from a whole host of things. The tongue and lips are one of the biggest orthodontic forces there are. So children who are do a lot of the habits, the finger sucking, the thumb sucking, the tongue thrusting, improper swallowing. I mean, every night when you swallow 400 to 800 times, that tongue is pushing those teeth in an improper position. So just by correcting a lot of those things, teaching children how to swallow properly, but we use the child's natural growth. That's why we try to catch them early. And that way we can prevent a lot of the problems that they're going to have in the future, not just with teeth alignment, but breathing problems. So the question always comes up, well, why are so many of today's children experiencing these problems when they didn't used to have that back in, as my parents always said, in old times, so why children now? Well, there's actually a lot of studies. Dr. Corsini, who is an anthropologist, looked at a lot of this, and his studies are actually very fascinating. And what we've found out and what we know is diet is a big part of proper bone growth and tooth development, not just in strength of things, but proper tooth eruption, proper alignment, and everything else. Lots and lots of research has been put out by him and his group about this. So there's really not a lot of debate about this at this point. And again, I'm not going to go through every little detail here, but that's kind of the general idea is, hundreds of years ago, we weren't afraid to give children things to eat. And as they use their teeth and muscles of their chewing, it properly allowed things to grow and develop. So as you can see there, a soft diet, processed foods, what a lot of people will call a Western diet, this increased underdevelopment of not just the upper jaw, but also the lower jaw. And what does that cause? Well, that causes the teeth to not come together correctly, and not just the jaw bones, but actually the teeth also. And as we go into that farther, again, all of this has been studied a lot. And you look at that compared to a first generation. So, after they introduced this Western diet or this soft diet of processed foods, first generation, 50% change in the rate of how everything comes together. And then you go down to the third generation, we're at 85%. So when I'm in my dental practice, and by far, I see more children that have dental or skeletal malocclusions than I see that don't. And, so clinically, I see the output of this. I mean, this is a true statement. Almost every child I see has some sort of problem, not just with their bite, but jaw and everything else, jaw development. So again, what are some of a lot of the causes of this? Well, we like to kind of baby children for longer than they probably deserve, as cute as they are. Again, I have 3 kids. I know what that's like, but prolonged use of pacifier, again, that's probably more for parents than it is for the children. We all need the baby plugs every once in a while. And then, prolonged bottle feeding, and then also the wonderful puffs that we all feed our children when they're young. And again, none of these things are bad in and of themselves, but when these things go on too long and we're afraid to allow children to use the teeth that they've been given, Instead, we want to give them all kinds of things that melt are easy to chew so they don't choke, or we're so paranoid about that it doesn't allow them to use the things that God's given them to use with their teeth and muscles to help those things develop and grow as they should. So as you can see there, the nutrition plays a big part of that in the development of everything. So when we look at children and how their teeth should look, this is what we would call kind of a perfect 5-year-old bite. Now, when parents look at this, they see the spaces and they're like, oh man, can we close down those spaces on these teeth and get rid of all the gaps? But that's the way children's teeth should look. And I guess in what they would call it, as they say here, a perfect 5-year-old smile here. Adult teeth are bigger than baby teeth, so they need that room as the adult teeth come in. And when those teeth are already crowded, or maybe what most people would consider a perfect smile, where there is no spacing, that leads into problems down the road. I see very, very few children with a bite like this. There's all kinds of problems, but very, very few of them come in looking like this. So, and again, when we talk about airway, not just teeth or straight teeth, but airway, airway is a lot of different things. It may not be what people just think about. But again, as you look at this picture, there's kind of 3 major parts to the airway, and they're all important, not just from a nose or, throat area, but all of them combined. And believe it or not, that the dental structures come into play in all of these, whether you have a wide sinus or a narrow sinus, all of those are dictated by how wide your upper jaw is. And again, those finger sucking or pacifier sucking habits make that more narrow, which decreases that airway. So all of these things are very, very important. Again, so when we look at these things, as I was just saying, as we know now, that as we expand that top jaw, make it wider, that's going to improve sleep disordered breathing, because patients can get more air in through their airway as that gets wider. But unfortunately, we still don't do a lot of this. But again, things are changing, and orthodontists especially are treating these things, doing a lot more expansion than they used to. And those are all great things, especially from a breathing perspective. And when we look at this picture, we're really looking at the airway here. On the picture on the right, you see that very restricted or narrowed airway. Let's see if I can pull up a laser pointer here real quick so you can see that. But, this little dark line going through here, that's an airway, a very constricted airway. And on the left would be what we would consider a normal airway for a 10-year-old. When you look at that, you can see those two, and it's very easy to see the difference between those two pictures. And what the difference in that breathing obviously is going to make for that child. And again, so when we look at the picture of, you put all the skin and bones and everything back on, you're not looking at an x-ray. Again, what we're really looking at is this jaw development. You look at the girl on the left here, and she's got a great profile, meaning she has a normally developed bottom and upper jaw. Well, you look at the picture on the right, and you can see that this bottom jaw is very, very, again, retruded or pushed back. And that's going to correspond to that previous picture of that airway that's just very, very constricted. Pulling this airway out, or pulling that bottom jaw out, allows that airway to open. So by guiding this growth at an early age to that, again, down and forward position, really allows things to take off and grow properly. And again, we see these pictures all the time, and everybody thinks, it's so cute, that girl's sleeping in the car, or if it's on the pillow, the mouth open. Again, I look at things differently now. Like that, there's nothing cute about that. That tells me that this child is having a hard time breathing through their nose, or their mouth breathing. Again, it shouldn't be that way. Children should not mouth breathe. So when you see these things, that's not a cute, normal picture. As cute as that little girl is, that I look at that and I say, oh man, we need to help her breathe better, to make her a better version of who she is, just to allow for proper growth and development, and to try to get things realigned. And again, so you see here, mouth breathing while sleeping causes airway constriction. And again, this does not improve in the vast majority of cases. So children don't grow out of these things, which is contrary to kind of previous thought that, hey, just let them grow out of it. They'll grow out of it eventually. But we're learning those things just aren't true. The vast majority of children do not grow out of it. And next up, we're going to kind of look at a video here.
Listen to this mother describe her baby's sleep disorder breathing. There he goes. Now watch what happens when she's able to open the airway by simply shifting the position of his jaw.
Now watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. And I open his airway. Just bring his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose.
So when we look at that, that really demonstrates you shouldn't hear children breathing. My oldest son isn't a snorer. He doesn't really snore, but he would breathe like that. Again, just a very labored breathing. And it's, again, when he was younger, I didn't know the difference. And so I didn't really think anything of it. But now that I know more and I'm armed with the proper education and everything else, that's not normal. But again, I hear children breathe like that all the time. And we just assume it's normal because so many children do it, but it's not. And as you could see, just by slightly pulling his jaw forward, completely opened up his airway, allowed him to breathe through his nose, and you could no longer hear him breathing. And I can tell you from experience with two of my children who are doing the Healthy Start for breathing issues, sleeping issues, that it was amazing to hear the difference of them going from normal, what I would call normal breathing for them at night, to wearing the little devices or mouthpieces that the system has, that the treatment has. It just really makes a huge difference. I mean, instantly. They can breathe through their noses and they breathe quiet. And you just don't hear a lot of the things that I would hear constantly, whether it's the grinding teeth or the loud labored breathing or even the snoring. So all those things are just gone. And you can see how simple it is. And again, that's what's so great about this system is we're looking at an airway. Again, I always tell people, because I focus a lot on airway with adults and children, but one of the benefits, the great benefits, is straight teeth. But when we look at the airway, we're really looking at what does your child's airway look like? And one of the things that we do sometimes in the office or elsewhere is we'll have people breathe through a couple different types of straws. Have some, just if you have these at home, give it a shot. Pick up a coffee stirrer and try to breathe through that with your mouth and see how well it is. And that's the coffee stirrer doesn't move a lot of air. And we just have to look at those things and say, is my child getting enough air? You see a garden hose over on the right, and obviously you're going to get a lot more volume of air coming through that. And by simply guiding the growth or allowing the child to breathe properly, it's going to increase that volume of air coming through. And we even let children try this, where you give them a coffee straw and let them try to breathe through it, and you just can't do it for very long before you're out of breath. Yet children or adults or children especially are doing that all night long every night. And we kind of assumed that it's not causing any problems, but we know so much better now that it does cause a lot of problems. So again, we kind of talked about this. This is just another chart that talks about some of the things that could possibly cause or does cause underdeveloped arches and jaws. And then what does that lead to? Well, as we just learned, that leads to a compromised airway. Again, we're not just worried about crooked teeth or what it does to teeth, but it causes breathing problems. Not being able to breathe through our noses. We see a much higher incidence of swollen adenoids and tonsils. Our nose is a filter for filtering out a lot of the stuff that we breathe in. It warms the air. And those are all great things for our airway. But when we breathe through our mouth, we lose all of that. So we see a much higher incidence of those types of infections. And then ultimately, what does a compromised airway lead to? It leads to the sleep disordered breathing that we've been talking about. And again, a lot of the symptoms that are involved with that. It's amazing how quickly getting these things treated makes a difference in a lot of these things. I mean, almost overnight, children's behavior will improve just from getting a couple of great nights of sleep and not having the breathing issues. And all of a sudden, that child that doesn't wake up well in the morning, or is maybe a little more aggressive or easy to anger, some of those things start getting better almost immediately. So again, what can a dentist do about this? Well, we can really help fix it, and it's a great way. It's non-surgical. It's not invasive. And again, Kathy kind of talked about this at the beginning. This isn't something new. This has been around for a very long time. Over 3 million cases treated worldwide, 3 million children treated worldwide. It's FDA approved, lots of, as she was saying, lots of amazing patents. A lot of ingenuity went into this. So what can the HealthyStart do? Again, we talked a lot about breathing, but it expands the dental arches, which helps, again, establish nasal breathing. It trains the tongue, as we talked about that. The tongue's probably one of the strongest muscles in the body, and it pushes teeth where they shouldn't go. It guides growth and development of the jaws where they shouldn't go. So the system will really help train the tongue and teach the child where to position the tongue properly during swallowing, which allows for proper speech and everything else. And then again, it also just eliminates a lot of the bad habits. So it really is a great system and fixes a lot of problems. So what else can it do? Again, we're guiding the growth and development of not just the teeth, but the whole jaw to correct a lot of these problems. And you'll see some pictures here coming up that have been corrected simply by going through the HealthyStart system. No braces needed at this point with a lot of these kids. Again, it corrects most orthodontic diagnoses to a class 1. And what does that mean? Well, that just means they end up with a pretty darn good bite after everything's said and done. And we know with all these cases, about 80% of the children don't need any orthodontic correction or afterwards, or if they do, it's very, very minimal. We're not talking the 2-3 years of orthodontics that a lot of these children go through by waiting until growth and development is already finished. So again, you can kind of read through that. All great things. So when we look at some of these cases here, you look at Michael here at age 9, and again, we've talked about this before. You see that retruded bottom jaw. We see what we call this bottom lip curl. All of those things are just intuitive of that retruded or pushed back mandible, that closed airway. And then here we see him after he's, again, reached probably skeletal facial maturity here, that he has that nice chin profile. It's not that retruded or pushed back. And so what does that look like for his airway? Again, you see his airway before compared to after. And all of that is the proper down and forward growth of this mandible as he's grown and developed. Without guiding that growth, I see a lot of adults that have that same lower jaw profile because they had it when they were a child. It doesn't correct itself the vast majority of the time. So again, we're still looking at Michael here. So you look at him at age 4, again, compared to at the beginning here to after. Again, this is without any orthodontics. And, most people or most parents are probably just looking strictly at the straightness of the teeth, which is awesome. But I look at a lot of different things when I look at this. Like when I look at beginning, you can't really see these teeth over here on the sides. And what is that caused by? Well, that pushed back jaw, the narrowing of his dental arches all causes a collapse in that airway, or narrowing of the airway also. So when I look at this age at 14, yeah, I see these beautifully straight teeth, but I see these back teeth now. I know you can look at those two and see the difference. And those are things that I look at. Again, the teeth are beautiful. I'm sure everybody loves the straight, beautiful teeth, but I look at the widening of these arches. You can see all those molar teeth here in this picture. And that tells me that he's able to breathe much better because of the widening and how much more room the tongue and everything else has. So again, comparing before and after, I see those beautiful teeth. So again, 12 months, you look at the top left picture there to that bottom right picture. Again, no braces, no brackets, wires, just simply wearing the HealthyStart appliances. Just to, again, we're guiding these teeth into place. You look at this bottom left picture here. This tooth is not going to magically fall into this space down here as much as we like to pretend it does. It's going to be crowded over here. And but you look over here, well, what's happened again? These teeth have been guided into place just along with that growth and development. We catch these things as they're coming in, and it allows everything to grow and develop properly. So again, a lot of people here were, interested in ADD and ADHD. And again, we know there's been a lot of research that has linked these problems with the sleep disordered breathing. And Dr. Bonnick, who's been one of the lead researchers in this, she looked at 11,000 kids over a 6-year time frame, and a lot of published data and research, peer-reviewed journals, one of the highest out there, where other physicians are looking at these articles before they're released. And so what did her research show? At least 50% of the children that have sleep disordered breathing are at increased risk of ADD or ADHD. Again, we kind of talked about that if the brain's not allowed to get the oxygen and all the chemicals that it needs at night during sleep, if that's disrupted, we can't expect a child to function what we would, I guess, quote unquote, normally without all the proper oxygen, nutrients, everything the brain needs to grow and develop. So it's no surprise a child that's lacking oxygen isn't going to grow and develop properly. And again, how about bedwetting? What do we learn about that? Again, same thing. This is one of those topics that we're learning more and more about. It's one of those, I guess, quote unquote, taboo topics that a lot of people don't mention, which is why we don't have as much information about it, although that's starting to change, whether it's maybe embarrassment from either the child or the parents or both. It just doesn't ever get brought up. But it's just a fact. It's nothing new. It's been around for a long time. But what we are finding is, again, this reduced oxygen just really affects a lot of the neurologic processes and hormones which go on, and all of these things help regulate our body systems and body functions when we sleep. So when those things get out of whack and aren't getting the proper things they need, these things result. Amazingly enough, bedwetting is one of those things. We treat children with a HealthyStart, and bedwetting is one of those things that goes away very, very, very quickly, usually within a week or two, a lot of times sooner than that, and bedwetting is gone. And again, it's just simply a child getting a good night of sleep. Their bodies know how to function. We are programmed to function properly when we're allowed to. And by giving a child that proper night of sleep, the proper oxygen, the brain works properly, and all of a sudden, things like bedwetting go away. And for those of you that have children that maybe bedwet at an older age, even some adults have been treated this way through HealthyStart and have gotten great results. But we know how that can affect a child, not just physically, but emotionally. They're afraid to stay the night at friends' houses, and especially in today's society where everything's social media, even starting at very, very young, if that were to happen, a child would never hear the end of that. And so these are very deep and emotional problems and ties that not just for children, but for parents who worry about this all the time. And again, the old analogy of, oh, they'll grow out of it. Well, sometimes they don't. And the other thing with that is, that's basically just relegating these children to deal with it for years and years and years, which they may grow out of it at some point, yes, but why do that when we can treat it? And so this is one of those things, again, we don't know a lot of hard factual data, but we do have a lot of understanding now of how important a good night's sleep is to controlling all bodily functions, not just, feeling good in the morning and things like that. So, I just encourage everyone that, if you have a child that has an issue with this, or if of families that have an issue with this, there's definitely an easy way to help with this. And it works amazingly and works quickly. And children are so relieved that after treatment with this. So I'm just going through some studies or some cases here of children that have been treated again. Again, this is what we're looking at. So again, no brackets or wires needed here. 2 years, you're looking at this, a 5-year-old and then going up to 7, so 2 years. And you look at that top picture of how her teeth came together originally. And again, I'm not just looking at teeth, even though that's what a lot of parents look at. I'm looking at how the jaws are related to each other. You can see that the big space, or what we call overjet, between those top and bottom jaws. And again, a retreated or pushed in bottom jaw and a pushed out top jaw, whether it's from finger sucking or thumb sucking. Then we look at that bottom picture, which is at 12 years old, and see how, again, beautiful teeth, right? Beautifully straight teeth, but I look at how those jaws relate to each other. Again, that bottom jaw has been guided down and forward, opening up that airway. And, you know, one of the things that we haven't talked a lot about, again, because this is more focused on sleep disordered breathing, but one of the great benefits of allowing these teeth to develop in the proper position, when you see that post retention, well, what that means is basically retainers, right? Again, I have a clinical practice, so I see children all the time that lose retainers or break retainers or dog eats retainers, and adults for that matter too. Once we wait for all of these teeth to grow and develop and then decide to go in and start moving teeth, well, retainers are needed because as the fibers grow to these teeth, we're stretching and pulling and twisting these teeth to get them to be straight. And these fibers are pulling back on the teeth somewhat to their original position, which is why we have to glue all these things or have people wear these things at nighttime to get teeth to stay where they're supposed to go. But when we guide teeth into the original position before these fibers are fully formed on these teeth, well, the fibers grow and attach to these teeth in the proper positions. So guess what that means? Well, a lot of these kids don't need retainers afterwards because the fibers have grown onto these teeth when these teeth are in the correct positions already. So there is no twisting and pulling on these fibers. And that's just a huge added benefit. It's a great thing for parents and children who I know struggle a lot with retainers. So again, another case, you're looking at a 12-year-old and 14, 2 years again here. And you can see the difference in how the teeth are, again, not just the teeth, but how the teeth are aligning, but also the jaws. And then also here again, another a big change here. And again, when I look at these pictures, you look at the top picture here, and you see you don't see the bottom teeth at all. The top teeth are just kind of overwhelming or coming down on those bottom teeth. Not only the front teeth, but you don't see any back teeth at all on either side. And then again, you look at this bottom picture. Again, all of this is without brackets or wires. No traditional braces here. And again, beautiful, beautiful straight teeth. Again, to me, that's a side effect, if you will, or an added bonus. But when I look at those back teeth, again, I really look to see, hey, look, I can see back teeth now. And what does that mean? Well, that means widened arches, widened airway, more air. All of those things are very, very, very important in the growth and development of children. So straight teeth and wider and better airways. So to say the HealthyStart changes lives, that is definitely an understatement. Kids want to be the best they can. Parents want their children to be the best they can. And it's amazing how quickly you see an already great child and just see how quickly they just kind of perk up and become better at everything, whether it's, you know, math and reading at school or behavior wise or some of those other things like bedwetting or you know, all of a sudden they don't have to be medicated anymore for ADD or ADHD. Those are wins. Again, a lot of us get into dentistry especially to help people, but we're used to helping people by fixing teeth, and which is a great thing and a great thing for people. But you know, to be able to actually get in there and change the trajectory of children's lives, it's one of the most rewarding things out there. Even though they probably don't appreciate it most of the time, especially the younger kids, but it is just a great and fun environment to be in. So again, it really does change lives. I think kind of going through a lot of these things again. And when I look at all of these awesome, great things that a lot of people have put a lot of hard work into, which are all very important things, the FDA clearance, the latex free, all of these things. When I look at that as that first bullet point to me, it promotes natural growth and development. I try to be preventative in a lot of the things as much as I can. And what's easier than just coming alongside a child and helping them grow and develop properly? And the system does that in many, many ways. So February, in the whole month of February, it's National Children's Dental Health Month. So at my office anyway, on Fridays, I've been doing a lot of promoting and just, hoping to see a lot of children just to do, free, as it says there, dental, sleep, and airway assessments. We just think this is so important for all children that we love being able to do this. We've been doing this for a while, but with February being the health month for children, that we really wanted to get the message out and just allow everyone to come in and be seen that wants to have their children seen. So again, thanks Kathy and everybody at HealthyStart for inviting me to come in and do the presentation. It's been great, and hopefully there was some learning involved, and I'll turn it back over to you.
Well, before we let you go, I'd like for you to tell parents a little bit about what that pre-evaluation is like, which is generous, and it's great because that is the best starting point, but it's you already showing your investment in the care of their child, because you and your staff are saying, we will, meet you halfway. We'll provide you with all of what we know. Let's just see what we can learn from your child. Explain how all that comes together.
Sure. The first thing I always reassure parents of is, as a parent, again, 3 kids, I remember going to doctor's appointments with all 3 of them. As always, like with my wife, it was a husband-wife combo. Carly and I would go in there, we're like stressed out and sweating, trying to keep all the kids from like drawing on the wall. We're used to this stuff, right? Like parents get so stressed and worked up over these appointments more than children ever do. So when you come in, don't be concerned about that. We're so used to treating children and used to the screaming and the crying and the constant noise. I always joke. I mean, for me, honestly, I honestly do not even hear that background noise. I have lived with it for so long that I honestly don't even notice it anymore. So parents really worry about that stuff. But what do these exams entail? We just come in, and honestly, it's a pretty easy environment. Depending on how busy we are, what room you're in, you may not even be in a traditional dental chair. And we just kind of bring the child in and parents. And a few weeks ago, we had a room with 5 kids in it and a parent. And we just kind of take turns. We jump one up in the chair, make it a game, and just kind of quickly look at the mouth and the airway and determine, hey, is this something that we think is going to be great for your child and beneficial? There's a little form that they fill out to just ask questions about, well, how do they sleep? How do they breathe? How do they, what kind of speech? Do they have any speech problems? Have they ever had speech therapy? A lot of those types of things. So it's just a very easy 1-page, form that they fill out, and just take a quick look inside and just have a good time with the child, everybody. And so it's very easy, very comfortable, even though, again, most parents are always stressed when they come in, but it's a pretty quick and easy exam.
Dr. Cope, some parents will be seeing this tonight. Some will be seeing it on a repeat or a re-showing of it. Tell the people who are anywhere near you how they can get a hold of that sleep questionnaire so that they can observe their children sleeping before they come in, and then how to set up the appointment. Where should they call? How do they get that done?
Yeah, right. So obviously you can call the office anytime. I think that was maybe on the screen before there. So yeah, so that's always an easy way, again, because we do see so many people, even for the Healthy Start exams, we would like to get appointments made for them, even though there's no charge for those or anything. It's just so we can make sure we have a room available, and you can always call, we can email, or what they call snail mail, or in the mail to people. And I believe they're even on our website. We've been updating our website to put all of our forms online, and I believe that is one of them that's online now. So they can actually just go online, I believe. And if not, I'm not 100% sure on that right now, but if you call the office, we can always email it or fax it or mail it, whatever's easier for them.
Okay, cool. Well, I know there's every way to reach you, and it's the smartest thing a parent can do for their child. We always say, don't wait, do not wait, do this when they're young. So Dr. Cope, what a fabulous evening. Thank you so much. It was so logical, just cause and effect and get in there and intervene and do this for your kids. So we thank you for being with us and for being a part of Healthy Start. We always have just such excellent doctors, and you're certainly one of them. Susie Lafredo has been operating behind the scenes, and she told me all these great things about you. Now we all know. And so thanks for being a part of our program, and thank you for tonight.
Sure. No, thanks again. Again, I can speak to this not just as a practitioner, as a dentist on that side, but also as a parent. I mean, you know, Kathy, just like you said, I mean, I suffered through this for many years, you know, without the knowledge of this. And I just look at my children and even my wife and I about, you know, the first time or the second time of watching a night terror and all of these things that, man, just if I could go back, that's something that I would definitely want to go back and change. So when you say just jump in and do it, man, it really does change a child's life and also parents. Because
family, the dynamic is changed by it. And, you know, I can't imagine doing anything greater for your child than giving them Healthy Start. No matter what other options may be on the table, this is the most profound impact on their health for the rest of their life.
I absolutely agree. So again, thanks again for inviting me to come in and speak. And
loved having
it's
you.
been great. Sure.
Absolutely. Look forward to the next time. And again, everybody, thank you for joining the Healthy Start family. We're here every Tuesday night for Family Overview. And we would like you to share this with others so that they can find out exactly what's going on with their kids and what we can do to help. So for Healthy Start, I'm Kathy Turner with Dr. Shane and Susie. We all say good night and thank you for being with us.
Thanks.